The average lifespan of the people presently in the world has changed from 60 years once upon a time to nearing 75 to 80 years nowadays. So we started seeing many people who are more than 50 or 60 years age. And we know usually after 55 to 60 years, majority of the men will suffer from some problem related to urinary passage, and that's most commonly because of a prostatic enlargement, which can be either a non-cancerous enlargement or sometimes even a cancerous enlargement. Majority of the people might not even know. They blame it on their health or age and say that I have to live like this forever, and they spoil their quality of life completely, getting up 4 or 5 times in the night to pass urine and suffering without sleep or everything. So these patients can understand one possibility now, that we can treat it with medication and make their quality of life better. Sometimes they may require some surgical intervention, which can be done in an endoscopic way with just 2 to 3 days of hospitalization, and they can be devoid of all the symptoms what they suffer because of this prostatic enlargement. As you know, as the age of the person increases beyond 70 years, the chance of you having a cancer of the prostate also goes up. So in the recent past, with people living for a longer period of time, we started seeing cancer patients becoming more and more, and people suffering with dissemination of the cancer into the bones and suffering at their terminal ages of life. So we would suggest that people who have any minimal urinary symptoms be evaluated for cancer prostate. If you detect it early, possibly you treat it early, you may not suffer from these sort of symptoms at your terminal age. So if you have any symptoms related to urination, do check for cancer prostate also, especially if you are more than 60 or 65 years age, and see that you can pick it up much early in the cancer life, and so that it can be treated very well. So understand that these urinary symptoms which are related to the age can be treated very nicely with medication, and occasionally may require a surgical intervention, and some tests definitely can detect a cancer at an early age or an early stage, and you can be treated radically so that you are cured of cancer.